Yeah. Good morning, or good afternoon, everyone. Today, we'll be presenting a community needs assessment focused on a growing public health issue, which would be syphilis in men aged 25 to 34 in the Los Angeles County. My name is Joseph Blackshear,
My name is Henry.
I'm Esmeralda.
My name is Miria.
My name is Karina.
and in general, our team has analyzed the scope of the problem, relevant behaviors and patterns, and epidemiological trends, and existing resources to determine the most effective interventions and priorities moving forward. Next slide. Here's a little quick overview of what we'll be covering today. We'll start with the behavioral profile of our targeted population, then explore the health issues itself. We'll review local epidemiological and current resources available in the community, followed by evidence-based interventions, and finally, our top recommendations for addressing the issue. Next slide. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. If left untreated, it can progress to serious health issues like neurological damage, cardiovascular complications, and even death. Our target audience is men between the ages of 25 and 34 in the Los Angeles County. The behavior of interest includes engaging in unprotected sex and multiple sexual partners, often without regular testing. This age group is critical because they represent a significant portion of new cases and often face barriers in terms of healthcare access. Syphilis rates among men are rising faster than in women. In fact, rates in males are 7 times higher than that in females. And in general, Black and Native Hawaiian and Pacific Islander males are disproportionately affected, which is highlighting a great racial disparity in health access and outcomes. Next slide. So why does this matter? So first, syphilis can lead to severe long-term health consequences, and if left untreated, it can affect the heart, brain, and nervous system. Rates are increasing dramatically in the population, especially among men who have sex with other men, or MSM. But the issue goes beyond just the number. Stigma and lack of awareness continue to undermine prevention efforts. Many men don't realize they're at risk and don't have access to routine testing. Disparities are also evident in race and socioeconomic status. Many men affected don't see care due to fear, cost, or mistrust in their healthcare system. That's why we need to understand the behaviors contributing to these rates and how can we effectively intervene with the targeted resources. We should be able to eradicate this entire preventable disease through the basic tenets of infectious disease control, through the use of antibiotics, treating those who have the disease, and educating the public. We have a general good diagnostic on how it is transmitted and the added barrier that there is no actual animal reservoirs. We have what we need and we know what we need to do. But there are wider public health challenges. Screening is inadequate, and while some women get routinely tested for STIs at their annual exams, men are far less likely to get routine testing. And because many people with syphilis have no symptoms, they won't seek out screening. Plus, many are at-risk patients don't have access to healthcare. And a lot of sexual health clinics have either lost funding or have closed over the last decades. And so following this, we will be presented with an epidemiological approach.
Okay, so to further emphasize the impact of syphilis, I will be going over some prevalence and incidence statistics provided by the Los Angeles Department of Public Health and Centers for Disease Control, along with other sources. So in 2022, the Los Angeles Department of Public Health revealed that there were 61 cases of early syphilis per 100,000 people in the LA County. And among those 1,000 people, males ages 25 to 34 had a rate of 224 to 276 cases per 1,000 people. Similarly, a year later, the Los Angeles Department of Public Health also revealed that men made up 84% of syphilis cases compared to women, and who made up 14%, 2023. Additionally, I included a statistic on men who have sex with men, which is a group that's disproportionately affected. And it revealed that in 2023, the men who had sex with men accounted for 32.7% of syphilis cases in LA County. So this graph is from LADPH in 2023. It's an STI report that visually demonstrates the disparity between syphilis rates among males and females within LA County. As we can see, not only do men significantly experience higher rates of syphilis, but when we break it down by race, ethnicity, the disparities become even more pronounced. So, for instance, in 2023, we can see that Black men had a syphilis incidence rate of just over 197 cases per 1,000 people, while in contrast, their white counterparts and Asian counterparts had 66 or 34 cases of syphilis per 1,000 people. In general, these differences are influenced by a combination of structural and social determinants of health, which include access to care, stigma, race, systemic racism, and other environmental and behavioral factors. So for this slide, we're just focusing on the overall numbers of syphilis cases reported in the recent years within Los Angeles County, particularly within men who have sex with men or men who have sex with women or just women, just to see like the contrast between the syphilis rates. So as we've seen from previous slides, syphilis is increasingly affecting men in the LA County, and the total number of cases reflects this trend. From 2019 to 2023, there has been a consistent year-over-year increase in syphilis cases, with the sharpest rises occurring among males 25 to 34, like previously mentioned. But overall, as we can see that here, throughout the years, men who have sex with men have um, a significantly amount, like percentage higher compared to women throughout the years, therefore indicating that this is a serious issue that needs to be addressed. And overall, just understanding case trends over time is essential for designing targeted interventions and improving public health outreach for this particular target group. So in this slide, I decided to include the incidence rates of syphilis cases among 6 different counties to help further emphasize the seriousness of syphilis around the world. Taking this into consideration, I just wanted to point out how Orange County and Ventura County tend to have lower syphilis cases compared to other counties, but as we can see, it's noticeable that Los Angeles County and San Diego County tend to have higher cases of syphilis compared to the other counties that they're being compared to. This, like I said, this is just to further emphasize how serious syphilis is within Los Angeles counties. Other counties may not be experiencing as much cases in syphilis among men, but that just doesn't necessarily mean that other places don't experience a higher percentage of people experiencing that. So another major concern in addressing syphilis is its strong association with the HIV co-infection, particularly among men who have sex with men. The graph displayed here shows the percentage of newly diagnosed HIV cases in individuals age 13 and older who also had syphilis or another STI. As we can see, syphilis cases between ages 13 and 29 in men are pretty high compared to other STDs, STIs that are presented in the graph. That just, like I've been saying, goes on to further emphasize that syphilis is a serious issue in men. And to add, according to research by Kojimiya and Klossner, it was revealed that nearly half, which is 47% of males who had sex with males, with syphilis were also co-infected with HIV in 2016. A separate study also found that 25 additional men who initially tested negative for HIV later tested positive 9 months after a syphilis diagnosis. These findings generally just illustrate that syphilis is not only a concern on its own, but also significantly increases vulnerability to other serious infections like HIV. So, just a general summary of everything I talked about. Um, we need to we must know that syphilis rates in men within the LA County have been increasing. Although it's not drastic compared to the female population, it's still something concerning and that needs to be addressed. Also, majority of syphilis cases are also within males who have sex with males or multiple partners. So creating interventions that can target those high risk behaviors can be ideal to help reduce these numbers in the population. In LA County, HIV co-infection among males who have sex with males is rising. It's another thing to consider. And overall, the target population for our intervention would be men ages 35 to 34 in LA County who have syphilis.
Okay, so moving on to behavioral profile. Uh, our target population, once again, is men aged 25 to 34 in LA County. And over the last decade, in LA County has seen a rise in syphilis in men, specifically, obviously, between that age range. And obviously, as Joseph mentioned, that it is around 7 times higher in men than it is in women, and that is according to the LA County DPH. In terms of early syphilis, there is two really types of syphilis that they refer to. There's early syphilis and congenital syphilis. We're going to be focusing more on early syphilis because congenital is more so passed from mother to baby, and we're trying to prevent the further spread of through sexual acts. So again, this is an STI that's caused by the Treponema pallidum bacteria, and this can be a risk factor to HIV, and if left untreated, can cause further health complications to the eyes, the heart, and brain. So it's something you do want to catch on early and get treated. And for prevention, so abstinence is realistically the only way to completely avoid early syphilis. However, we know that this is not the route most people take, and it's not a popular option. Testing and screening, regular STI testing plays a major role in stopping the spread of syphilis, but unfortunately, a lot of individuals in this age group either delay or avoid testing altogether, whether that's because of a stigma, access issues, or just not taking the right risk. So, as we see later on, there is a very low perceived risk and a very inconsistent condom use. And when you have a mix of these, it doesn't really go well, and stigma plays a lot part in this. And this is all according to the CDC. And we can see in the graph in the middle, this is what they're referring to earlier, the age of 25 to 34 in LA County. As you can see, there's a spike in cases. If you want to go to the next slide. All right, so some risk factors. As mentioned again earlier, ethnicity and minority groups are a higher risk, and this is the case for a lot of diseases, and this could be due to health inequities, health disparities, lack of resources, clinics, testing, stuff like that. Uh, Again, mentioned earlier, gay and bisexual men are more at risk because it's men who have sex with men. As you can see, men who are a higher risk. So if you're having sex with other men, you're obviously going to get increased that risk. Unprotected sex, so you get no protection at all against any STIs and syphilis, and sexually active, any type of sexually active people, any form of it, so that could be oral, anal, vaginal, you are all at risk. Uh, Polygamous and multiple partners is something that people don't really mention. So I think the focus is usually made on testing and on unprotected sex, but having more than one partner can increase chances. And people with three or more partners had over 3 times the greater odds of syphilis infection compared to those with one partner. Also, I'd like to mention that unprotected sex, that doesn't include people who have sores. So people who have sores, it's a symptom, and people with sores, even if while wearing a condom, you can still be infected if you come in contact with those sores. Okay, and then next slide. All right, so in this data analysis, in this survey, in our target population, we found an average number of sexual partners in the past year was around 4.1, and around 67% reported using condoms inconsistently. So that means even when people are aware of the risk, they're not always taking the steps to protect themselves. Even more concerning is the average perceived risk. On a scale, they were asked for a scale of 1 to 10, and for the risk, and the average was about 1.9. So despite high risk behavior, most individuals still felt like they weren't likely to get infected. So this tells us that there's a disconnect between the behavior and the risk perception. And that's something that interventions need to address directly. So in short, the combination of high risk behavior, low perceived risk, and inconsistent condom use creates like this perfect storm. So you can see the spike that we have currently in this target population. And I'm gonna pass over to Esmeralda so she could go over the existing resources.
Okay, so there are many syphilis intervention resources that are currently available for men ages 25 to 34. Most of the available resources provide general information about syphilis and prevention strategies, such as condom distribution, testing locations, treatment options, and counseling services, as well as educational information. Many of these programs are also primarily focused on MSM populations, um, which they do have a higher reported rate and are a higher risk, but they're not the only group or subgroup that are at risk. And then very few of these interventions are delivered digitally or through online mobile platforms. Next slide. So first we have one local resource, which is the Los Angeles County Sexually Transmitted Disease Program. This is a local government intervention within the Los Angeles Department of Public Health. This program operates free or low-cost clinics that provide testing and treatment for syphilis and other STDs. They also provide educational materials that cover prevention, symptoms, early detection, and any treatment that may be needed. And it can also be translated into like multiple languages or to serve different diverse populations. This program is supported by a combination of local and government funding, federal grants provided by the CDC. Next slide, please. And then next we have the Los Angeles LGBT Center, which is a community-based sexual health outreach and one of the largest LGBTQ nonprofit organization in the US. They're heavily focused on STD awareness, and they provide low cost or zero cost testing and treatments. And then this center also provides online resources such as patient portals and then a strong community health education. And then this center is also supported through grants, donations, and fundraising. Next slide. And then next we have the Men's Health Foundation, which partners with different medical clinics to provide health services, which includes syphilis testing and treatment. They also offer health behavior services, which can help support individuals to navigate the stigma or any STD syphilis management. They also provide services at low or no cost and are funded through a mix of federal grants and private donation. Next slide. And then lastly, we have the AIDS Project of Los Angeles. They're another nonprofit that was founded in response to the AIDS crisis, but has then grown to include a broader and more STDs, such as syphilis and the broader aspect of sexual health care. They also offer a wide range of services such as screening and treatment. as well as prescriptions and counseling. And they also offer online health portals and mobile intervention tools that can be valuable to many. Next slide. However, when we're looking at these existing resources, we have identified across all these programs and resources that there are gaps and limitations. So first, we have the resources that are heavily focused on MS populations, which unintentionally leaves out those other men within our age group, which can include men who don't have sex with other men who are also at high risk. Secondly, we also, this which is more, which continues to persist is access barriers, such as a common issue would be limited clinical hours for to go get tested or get treatment, which could be a big barrier for many men who can't take days off during the week or they can't visit the standard business hours, which this can create missed opportunities for them to be tested and then treated for syphilis. Another notable barrier or limitation is lack of digital or online interventions, which can limit access to those who prefer it or those who um, need it. So, such as those people that can't go to physical locations to get tested or treated or seek counseling services. Um, and another major gap is lack of strong evaluation frameworks. So it's hard to determine if these programs and these resources work in long-term effects and if there's enough engagement to be able to notice the long-term effectiveness of the programs. Next slide. So to be able to address these gaps and limitations, we should be able to increase flexibility in delivering these services, which can include expanding clinic hours or introducing self-testing kits, which are similar to that can be similar to like COVID-19 testing, so that men can have these services at hand at their own home at their own schedule. And research has shown that self-testing can be an effective way to increase STI screening uptake. Another way could be broadening the outreach beyond the MS communities, making sure that it's inclusive for all men within the age groups and within different diverse populations. As well as, most importantly, we need to see stronger evaluation frameworks in which we're able to see what is working and what is not working within those programs to better improve the outreach and then the like strategies that are more relevant to those different subgroups within the age groups of 25 to 34. And then it has been seen and said by participants that it's better to build these services around the needs and realities of people's lives rather than um, what is what they expect to see, because that way they're more likely to use these services rather than have these barriers built around what could potentially save their lives and prevent syphilis. So now I'm going to pass it on to Mireya.
Okay, now we're going to go over evidence-based practices and solutions. So what exactly works for syphilis? Next slide, please. So it's clear that syphilis remains a concern in this population, but how do we reduce transmission? Is saying no enough? Can we afford to ignore the issue? And where can individuals turn to if they do find themselves affected with this disease? Is there a single approach that we should all follow to effectively educate such a large audience? So let's look at how public health experts have addressed these questions and tackled the issue. Next slide, please. Okay. Is there a class one can take to learn almost everything about syphilis? If there was such a class, does this 100% guarantee that the rates will go down completely? What is the most effective way to educate people to reduce the transmission rate of syphilis? Well, U.S. Preventative Services Task Force has seen and states that the behavioral interventions is the best method to educate and help fight the transmission of syphilis and reoccurrence of STDs. The task force performed a systemic review of randomized and non-randomized clinical trials where behavioral trials were collected from primary care offices. It was concluded that intensive behavioral counseling methods, such as meetings that were greater than 30 minutes, do reduce the possibility of participants catching STDs. In some trials, it was seen that STD transmitted infections were reduced, diagnoses were reduced, and in other trials, it was seen that these counseling interventions increased the use of condoms and reduced the occurrence of unprotected sex in participants. Next slide, please. An additional way to help fight the syphilis transmission rate comes from the help of public services. Things like web-based programs that offer information and case management for the infection and at-home test kits are just some of the services offered to the public at little to no cost. These are helpful services, but do they generally help the population? Does our population of interest use these as a first sign of prevention? In acceptable interventions to help reduce syphilis transmission among high-risk men who have sex with men in Los Angeles, it was concluded after voluntary interviews with 19 participants that these public services do work. The participants of the study agreed that incentivized syphilis testing, prophylactic medication, and websites that give reminders to test are the best way to help reduce transmissions. Even better, these interventions were the most accessible and included an important population, as all participants were diagnosed with syphilis. Although a small population size was used in these interviews, it does bring real voices to the forefront of the issue. And we can't generalize the findings, we can't generalize the findings to a whole community, but this does open the door to bigger conversations for access to these social services. Next slide, please. The best way to know if you do have syphilis is through testing. There's no way to tell just by looking at someone. But does our target population and age group actually get tested? There was an actual campaign called Get Yourself Tested that was made in response to the prevalence rate of STDs in adolescents and young adults. About 2,239 high school students and college students aged 15 to 25 were surveyed online and asked if they were aware of the campaign itself. The campaign aimed to promote the behavior and preventative testing and to start the conversation and an open line communication between the population and the healthcare providers. Both high school and college students agreed that they were more likely to have spoken with a romantic partner or healthcare provider compared to those who have not seen the campaign. It was also seen that college students had a higher awareness to get STD checks compared to those of high school students. Authors were able to conclude that there was an increase of positive sexual health behaviors after being exposed to the campaign. Next slide, please. Another campaign focused specifically on syphilis itself was testing. Testing was called Stop the Stores, which ran from 2002 to 2005. So it was a pretty lengthy campaign. The campaign was active within that year, and authors were able to obtain data in 2004 through a cross-sectional brief survey method with about 564 participants. The survey was administered at 2 community events meant for the LGBTQ community. And some of these participants, about 8% did report having syphilis. The study also showed promising results in the effect of social marketing campaigns. Out of the 564 participants, about 59% reported seeing that campaign. And it was found that men of color were twice as likely to discuss that campaign with friends, and about 39% of participants agreed to test for syphilis after seeing the ad. And 40% of participants shared that they began talking to their friends about the STD itself. This is good to see that people are beginning to take control of their own behaviors after being exposed to these campaigns. Next slide. And as we just talked about, there are many methods to help educate, motivate the public to help fight the rise of syphilis rates. But there are some limitations in these studies that should be acknowledged for future interventions. Most of these interventions included adolescents and young adults. Some interventions included our targeted age group of 25, but more interventions should be made for the age group of 25 and up, as this is the most vulnerable community, as we stated before. Although syphilis itself is also an STD, it seems to receive less attention than other STDs such as chlamydia and gonorrhea. For example, 2 out of the 4 interventions I highlighted right now spoke primarily over syphilis itself. But it is equally important and should be prioritized in public health intervention and efforts. And now we're going to be talking about priorities and recommendations in help fighting syphilis transmission rates. So some of the priorities our group came up with was to increase condom use frequency in all participants of sex and to increase knowledge on syphilis itself. And we also do encourage routine STI testing. Next slide. Our target population, as we've been talking about, is men aged 25 to 34 with syphilis in the Los Angeles County. And this is typically men who engage in unprotected sex. And the behaviors we like to target now are people who have unprotected sex, people who have multiple sexual partners, and or people who are not regularly testing for STIs. And now I'll pass you over to Karina, who's going to talk about the interventions to consider when fighting syphilis transmission rates.
Okay, so for the first intervention that we are proposing, it's more behavioral, targeted to the population. It was inspired by the U.S. Preventative Task Force data. It includes a 45-minute web meeting that basically educates participants on syphilis. It highlights services and that are available to the public in case participants aren't aware of these resources and certain things about syphilis. So like I said, it'll also include resources for local STI clinics and educate about STI testing and how that works. It'll include key speakers that have also been affected by syphilis to further encourage people to go get tested. Another intervention that we would like to propose would be an education-based one, specifically tailored to men who don't have sex with men, since we believe that a lot of interventions or programs are targeted towards men who have sex with men. So this intervention would basically be a 1 hour online or in-person meeting that is scheduled 1 to 2 times a month. That meeting, educators would provide a brief overview of syphilis and STI basics. They'll also provide personal testimonies from men who do not have sex with men from diverse backgrounds, and it will also provide participants with an additional list of resources that they can use. And then this is our presentation, and these are reference slides.